All right, we'll go ahead and get started. Thank you all for being here for our COVID-19 vaccine media availability. On the docket today, we'll have Melody Osborne from Renown Health, James English from the Health District and the COVID-19 response team, and Dr. Nancy Dow from the Washoe County Health District. Melody, if you're ready to go, please start us off.
Good morning. Thank you, Scott. Renown has been pleased to work with Washoe County Health District, the state, and the CDC to distribute the limited supplies of COVID-19 vaccines. To date, our vaccine team has administered more than 73,000 dose 1 and dose 2 vaccines to our medical staff, our Renown employees, and to our community members. This Wednesday, May 12th, will be the last day that we administer the first dose of COVID-19 vaccines to our community members at our drive-through clinic. Our vaccine clinic will remain open through June 4th to address anyone who needs their second dose of the COVID vaccine through Renown Health. So if you have not scheduled your second dose of the vaccine, please make sure to schedule that prior to our closure on June 4th. It has been an absolute honor assisting our local and statewide health partners in vaccinating the hundreds of thousands of community members here in Washoe County. Individuals who are 16 years and older who are still interested in receiving the Pfizer vaccine on May 12th are invited to make an appointment through MyChart. We are also offering walk-ins from noon to 2 p.m. Minors who are 16 and 17 must be accompanied by a parent or a guardian. If you need any assistance, please call our number at 775-982-2781, and we will continue to provide ongoing updates to keep our community safe on our website at covid.renown.org. And Scott, those are my updates for today.
Thank you very much for that, Melody. We really appreciate it. We'll go now to James English from the Washoe County Health District and the COVID-19 Incident Management Team. James, you ready?
Good morning, everyone. First, I'd really like to thank Renown for all their work, their partnership, and their planning with us to execute as many vaccinations as they have. They helped us set up our first pod location here at the Health District and test drive it, work all the kinks out. And since then, it's been a great partnership, and we have worked closely with them. And I'm sure we will continue to work closely with them as we go through this pandemic. Over the weekend, we surpassed 71,000 fully vaccinated individuals here at the Washoe County Health District pod, and we surpassed 153,000 total vaccinations provided. To date, our community has, of the eligible population available for vaccinations, 55+% of them have started the vaccination process, of which over 42% have completed it. And the only other update I'd like to give out is that the state has received some calls through some of their emergency reporting numbers that there are individuals out within the community that are going door to door stating they have extra vaccine available and can actually give you a shot here and at that time that they show up at your door. We have not heard of that occurring here in Washoe County, but want to let everyone know that while people may be canvassing the neighborhood to let you know when vaccination events are happening or to encourage you to get vaccinated, no one is going to show up at your door and offer you the vaccine unless it's been pre-scheduled through our homebound system or through another medical provider. But that is out there. It's sad to hear people are doing things like this, but we wanted to bring attention to that. With that, Scott, that's all I have.
All right, thank you, James. I'll now pass it to Dr. Nancy Dow from the Washoe County Health District. Dr. Dow, if you're ready, please go ahead.
Thank you, Scott, and good morning, everyone. So we do see that Washoe County case numbers have been lower recently, but we're not out of this COVID pandemic yet. When we look to the entire US, there are still surges in many states, and what that means is that a summer vacation or an out-of-town sports event can easily bring back new infections. And as a global pandemic, if we look out internationally, we see countries like India doing so horribly, 400,000 new cases per day. This is not just a humanitarian catastrophe. This kind of spread is creating fertile breeding ground for new variants. So the only way for us to reach the light at the end of the tunnel, to not have to constantly look over our shoulders wondering when another surge will crush us, is to get enough of our community vaccinated so that we can reach herd immunity, or at least an equilibrium with this disease so life can return to somewhat normal. So this morning, I want to briefly address a few of the top concerns circulating within the community for those who are hesitant to get their COVID-19 vaccines. The top concern is still regarding vaccine risks. The FDA and the CDC have been pretty transparent with reporting cases with severe reactions and have taken precautions to investigate any associations. So this type of open caution is good. That's what we want to see to ensure safety. But do note that the chance of a severe reaction, such as a blood clot from the COVID vaccine, is 1 in a million. It's extremely rare, and the benefit of protection outweighs the risk by far. Another big issue that holds people back in this question about COVID vaccines is that it's being developed way too fast. So to clarify, the COVID vaccine went through the same process just as all other vaccines in terms of development, planning, testing, and clinical trials. All these are necessary before any vaccine can even go to the FDA for an evaluation. So why is it faster this time? Well, SARS-CoV-2 is a new virus, but it falls under the coronavirus family. So there are hundreds of coronaviruses like SARS and MERS. Research studying coronavirus have been ongoing for many, many years. This isn't something we started from scratch back in 2020. Also, we now have genomic sequencing to quickly sequence the whole genome of the SARS-CoV-2 virus. This is something we were not able to do, say, back in the 1960s when the measles vaccines were being developed. And the big thing that expedited this process was the level of financial support and global support we had with the COVID-19 vaccines. Vaccine development is extremely expensive. Normally, you need to wait for funding before each step, making this a very lengthy process. In the case of the COVID vaccines, because the funding barriers were removed, multiple planning and execution stages happened simultaneously. All these really helped the faster timeline, but there were no cutting corners. The final concern I want to address is that many people, especially the younger population, believes that because they're young and healthy, they will not get COVID, or if they do get COVID, they won't be really sick. Well, if you're saying that, then first of all, you are really missing the point about the variants. Many variants are not only more transmissible, but also increase the likelihood of symptom severity. We jumped from 30% of our sequenced cases being the B117 at the end of March to over 50% now within a month. It's pretty clear how quickly a variant can permeate. And you're not just thinking about yourself. If you are a susceptible host, you can pass it on to your family and your friends. And for those who gamble on the chance of not developing severe COVID symptoms, recent studies have indicated that cases with mild COVID symptoms also create long-term health issues, such as loss of taste, loss of smell, and neurological and cardiovascular burdens that increase the likelihood of morbidity and mortality. It's a pretty dangerous time to be unvaccinated. So we are team humans versus team virus. Year 2 into the COVID pandemic, both sides picked up some new weapons. Team humans got vaccines, but team virus is coming out with a new hard to control variant almost every few weeks. How soon we get to have this pandemic under control and to end really is about vaccine urgency. It's a race we're in. It's about getting everyone to get vaccinated as soon as possible. Any day now, we would expect to see the Pfizer vaccine receive FDA emergency use authorization for ages 12 to 15. I strongly recommend parents to get their children vaccinated as soon as it becomes available. For kids, we're seeing it's a very safe vaccine. The Pfizer clinical trial for the 12 to 15 age group showed that the vaccine is 100% effective. It has really good antibody response in this age group, more than for adults. It's also important to remember that the vaccine works on your immune system. It's not going to harm your endocrine system or your hormones. It's not going to affect your growth. What it does do is protect you. I'm very optimistic that we will reach a high enough population immunity level in our community if we continue with our efforts together. So we will do our part here in vaccine distribution. I ask everyone in the community to do their part to protect themselves and their loved ones. Thank you, and with that, I will turn it back to Scott.
All right, thank you very much for that update, Dr. Dow. We'll now open it up for question and answer. We have Melody Osborne from Renown, Dr. Dow, who was just talking, and James English from Washington County Health District and COVID-19 operations. So if you have a question, please address it to one of those specific individuals. Please go ahead.
Dr. Dow, this is Siobhan McAndrew from the Reno Gazette-Journal. You mentioned the 12 to 15 age group. What are you hearing about children younger than that? Do you think vaccines are coming for younger age children sometime soon?
Yes, so Pfizer is planning maybe by fall. So their plans by September. So definitely within the fall, they are planning to have children 2 years and up getting vaccines coming out.
And do you think those vaccines will will eventually kind of be off that emergency use list? I know they're doing any day now. It's supposed to happen for adults, but eventually, do you foresee those coming off the emergency use list as well?
Yes, so with vaccines, when you go to the FDA for approval, there's 2 routes you can take. One is EUA, which is Emergency Use Authorization. The other route you take is the BLA, which is a Biologic License Application. And what that means, the difference between the two really is just time of observation. So when these emergency use authorization vaccines came out, we really didn't have the benefit of waiting maybe 6 months to see the results on the population. So for adults, for Pfizer, for instance, it's been since December 2020 when it came out. It's almost 6 months, so they're thinking of applying for the BLA application. So with children, once we have enough population data following them through community efforts, then they will probably be applying for BLA as well.
This is Paul Nelson with 2 News. Melody, over at Renown, are you guys kind of looking at you guys kind of slowing things down this week as a job well done, or is it more of a disappointment that more people aren't signing up?
That's a great question. While we have been very excited to assist our community, we would like to see more members of our community receive the vaccine. I think the decline in demand that we've seen is happening a little bit sooner than we originally anticipated. But again, very, very proud to be a part of this team in vaccinating our community.
And Jim, are you seeing the same type of slowdown up there at the Washoe County pod?
Yes, we have seen a slowdown in the amount of people that are scheduling in advance to come through our location. We're continuing to try to message that out. We're also now open for first doses anytime our pod's open. So we're hoping that'll help. And we're going to try some different media and outreach to try to continue to get people down here to be vaccinated while we go out into the community at the same time.
Dr. Dowd, you mentioned that really it's about people doing their part. It seems like everyone's talking about they want things to get back to normal, but a lot of people aren't willing to get that vaccine. How important is it that they look into this and possibly change their mind to get to that 75% of the population possibly vaccinated?
So our goal is to get people vaccinated as soon as possible, as many people as possible. It doesn't really matter whether we are reaching that herd immunity level. I'm okay if we don't, if we reach a high enough population level, say maybe 60% or 70%, that might also just be good enough for our community to bring the numbers drastically down, and we can have this virus live with us in an equilibrium like we do with so many other diseases. But if we don't get close to a high enough population vaccination level, then life may never get back to normal. Look what's happening in India. It's not just a humanitarian issue or geopolitical issue. It's really a huge public health concern. And we don't want to keep on looking over our shoulder thinking, oh my God, another surge might be coming to get us. we want to feel that sense of safety as we go back to normal.
And one more question is for whoever wants to answer this. For those people that are holding out, hoping that enough population does get it, maybe they'll take care of this problem and we won't have to deal with it. What do you have to say to them? And that's for anybody, whoever wants to answer that.
Well, from my standpoint, I think that anyone who's thinking that needs to just do some self-reflection and realize that these vaccines are highly safe. We've been vaccinating now for close to 6 months. We have very few side effects. They're minor, and we have vaccine available. So please come down here and don't wait on someone else to do what you can do.
What kind of numbers are you guys seeing right now coming through the pod compared to maybe at the peak?
That's hard to tell because we're doing second doses again today. So this morning we have over 800 scheduled, and then we have a few hundred this afternoon where we're doing first doses. So we have seen a dramatic drop off, and we're hoping that we continue to see some uptick, and we are preparing for the younger age groups, and that's why we're keeping our operation up and going.
Any other questions from media? All right. Thank you very much for being here. Just a quick update. We'll be back again on Thursday at 11 o'clock. And then also we have in the plans for a community pod at St. Peter Canisius Church in Sun Valley for this Sunday. We'll be sending out there will be a media advisory going out about that one. But if that's something you guys want to cover, it will be Sunday. It sounds like at 9 o'clock to 1 o'clock. So we'll send you more information on that. If you have anything further, feel free to reach out to me. And otherwise, have a great day.
Thank you.